Hi, this is Dr. Tom Rogers coming to you today with our weekly podcast. I'm going to talk about another vitamin today, a very important vitamin called vitamin A, because it has so many different functions that's unbelievable. Everybody needs vitamin A, which is really a fat soluble vitamin. Remember, A, D, E, and K are your fat soluble vitamins, so they can be stored. Um, and they should be taken with food. Remember that. Um, so really, vitamin A has three different forms: retinol, retinal, and retinol esters. There's really two forms that you need to be concerned about. One is the animal products, and you get that more from dairy, especially egg yolks, liver, and salmon, among some other things like oils. And then you have forms that come from plants. Think beta carotene, which is these are really precursors to vitamin A, whereas the animal products are vitamin A itself. And the plants, beta carotene is the one you're most familiar with, although there is an alpha. Comes more from fruits, veggies, and sweet potatoes. But turns out vitamin A is essential for cell growth, immunity, fetal development, and vision. Remember that. Everybody thinks of vitamin A for vision, and it's true. It's very, very important for your vision. So as you get older, you start worrying about this. That's why I'm wearing my glasses today. I usually don't wear them, but I'm going to talk about vitamin A because at 66, I do require glasses a lot of the time now for reading. So it turns out because of vision, vitamin A combines with an element called opsin to form rhodopsin, which is necessary for color vision and low light vision. That's very important, low light vision. As you get older, you'll notice you won't see as well at night when you're driving. So it also maintains your cornea and conjunctiva, the lining, the outermost lining of your eyes. So very, very important for overall eye health. But it also turns out, and we'll talk about it in a minute, it's very good for surfaces of your body, tissues that are surfaces like skin, intestines, lungs, and bladder. It supports immune function by supporting the growth of T cells, mostly. Also some beta cell function as well. But T cells are so important, especially when we're talking about COVID-19, those memory T cells that you get with innate immunity. T cells are a type of white blood cell that protects you from infection. Remember that. It's very important. Vitamin A is also a very potent antioxidant. Clears out free radicals. It protects against macular degeneration. Of course, we talked about the age-related macular degeneration that happens with so many people. It protects against cancer, especially lung cancer. In fact, there was a study of 10,000 adults, and it determined that those with the highest levels of carotenes had lower risk of dying from lung cancer who were smokers, even less than the non-smokers with the lowest levels. That just astounded me. You got to be careful, though, if you're a smoker, because if you take too much vitamin A, direct vitamin A, it can be very dangerous. It can lead to an increased risk of dying from lung cancer. So bottom line there is don't smoke. That's a no-brainer for anybody. There was vitamin A studies that also have shown that there's lower risk of bladder, breast, and ovarian cancers as well. And it turns out vitamin A is very important for reproduction, both for the sperm and egg quality. So remember that. The WHO has said that vitamin A deficiency is a leading cause of blindness in children. You don't see so much of that in the United States because we usually have enough vitamin A here because we're well maintained on what we eat. In third world countries, they don't have enough food, as you know. Um, it's probably the leading cause of vitamin A deficiency is the leading cause of night blindness, and we see so much of that. It also, when you talk about skin, it prevents acne. Think Retin A cream that we put on our skin for acne and to decrease wrinkles. I mean, Retin A is essential for anybody past 30 who's gotten a lot of the sun exposure. We give it out every day in our office. Um, the most potent form of Retin A is accutane, that prescription medicine prescribed by dermatologists under very strict adherence. You have to sign things because you have to follow your triglycerides. You have to be on a birth control pill if you're a female. It causes embryological damage where you cannot take this if you're thinking about getting pregnant. But there's huge doses of direct vitamin A in accutane. That's how it works for virtually all cases of bad acne. Um, so it turns out that the deficiency of vitamin A causes increased production of keratin. Keratin is that protein matrix that plugs your follicles and can cause acne. Most common cause of acne. Then you've got your propionic acne vulgaris. It can come in there and is the form of bacteria that gets it infected, and it can turn cystic. But in any event, another thing that can help acne is zinc. Zinc is very important for preventing acne in adolescents as well as adults. So there's so many things that impact your health with vitamin A. It also works with vitamin D for bone health. That's one reason I started looking into vitamin D. I realized you need some A in there as well for the D to work good. So how much vitamin A should you take? The RDAs for vitamin A are, I think, about 900 micrograms a day for men, 700 for women. That's way too low. The RDA is meant to just be really dumb advice. That's what RDA stands for. So you need more of it in this toxic world. Some people say don't go over 10,000 IUs, which would equal 3,000 milligrams. Of course, we're dealing with international units and milligrams. It's somewhat confusing. So come into the office and we'll help get you on your proper forms of vitamin A. But if you could get toxic on vitamin A. That'd be kind of hard to do. If you did, it could cause liver damage, vision damage, nausea, headache. But that'd be hard to do because most forms of vitamin A take the place. They're plant-based, like beta carotene. You could take too much of it, but your body won't overutilize it because it's a previtamin. It turns into the direct form of vitamin A, retinol. So it'd be hard to do that. The surest and safest way to get any vitamin is to eat the food. It's very hard in most cases to eat enough food to get your vitamin A. You can even check your micronutrient levels to see if you're deficient in vitamin A. A lot of times we do that in the office. So remember, the provitamin A is from the previtamin A is from plants. Beta carotene is the best part. Now I do see some people that eat so many carrots that their skin turns orange. Have you ever seen that? Their skin and nails will look orange. You can immediately tell somebody who's eating a ton of carrots as an anti-cancer strategy. And it's kind of odd to look at. It really doesn't hurt them, but because like I say, you can't get so much to damage your liver because your body guards against it. Your supplements or medication, you could get too much direct vitamin A, i.e. accutane. But accutane has something like 200,000 international units, which would be equal to 60 milligrams of direct vitamin A. So that if you took that for months and months and months, it could be very toxic. That's why they follow your liver enzymes if you're on this. With Accutane, you take breaks from it anyway. Use it for a few months, then stop it. But that's really high doses of direct vitamin A. So in your supplement form, it's going to be very hard to get too much to overdose on. Your body just won't allow it most of the time. But if you found yourself, if you added a fairly high dose of it, then I think you can get it as an over-the-counter supplement of like 25,000 IUs. But that's from plants. So like I said, it's going to be very hard to overdose on that. But if you ever get dizzy, headache, nausea, then you know you're taking too much of any, even vitamin. Like I said, it's very hard to overdose on vitamins. I don't think I've ever seen it. Not that it's hasn't been done, and I'm sure it has, but it's just rare. Myself, I like the Life Extension MacuGuard because it has a little saffron, which is another little great supplement. It's actually a spice that helps in weight control. It calms you down, and it's very good for vision as well. But I take a little extra A as well with a little beta carotene, and plus I have my 2-a-day Life Extension multivitamin, which has about, I think, around 500 IUs of vitamin A in it, in the form of beta carotene. But anyway, so I think vitamin A is a very essential fat-soluble vitamin that you need to think about taking, especially as you get older and you notice your vision is not like it used to be. So think about vitamin A in the right forms. It has a lot of benefits for anti-cancer. It's a great antioxidant. It helps your immune system, it helps your skin, and it helps your vision. So it also helps younger people in reproductive years. So think about vitamin A. I hope this has educated you a little bit on this. I hope to see you next week. Thank you.